seat wherever you feel more comfortable. Okay, so tell me, was it easy getting here?
It wasn't bad. It wasn't bad. The rain kind of, made the trip a little slower, but it wasn't bad. I got here early, so, no complaints getting here.
Okay, that sounds very good. And I was trying to get your name, but how do you pronounce that?
It's Arkira.
Arkira. Okay, sounds. Where did they get that name from?
A car.
A car?
Yeah,
Oh.
Acura.
Oh, wow. Whose idea was that, mom or dad's?
My mom's.
Your mom's. Okay. Okay, well, as I mentioned, I'm Dr. Rivera. That's Orquídea Rivera. So the Orquídea pretty much sounds close to Arkira, right?
Mm-hmm.
Okay, I am a licensed clinical psychologist, and I pretty much have some health services. I'm a health services provider here in the state of Maryland. And I know I did send you the information, the informed consent, as well as the papers that you read outside, and you did fill out the initial intake, but it's very important that I go over some important points here as part of the process, okay? So just wanted to kind of review a little bit on this. My sessions do go for 40 minutes, 40 to 45 minutes. The initial cost you already discussed that outside, and one of the important things is that I am an eclectic therapist. I have different approaches. The approaches that I use in my therapy, they go pretty much according to each individual and the situation that they are presenting at the moment. When I evaluate them, I pretty much try to teach my clients how to dispute their beliefs, and try to convert unhealthy emotions onto more healthier emotions through the process of any cognitive or behavioral emotive therapy. So that's the approach pretty much that I use. I hold my PhD in clinical psychology from Bowie State University, and I also obtained my Master's of Arts in counseling psychology. My clinical experiences include working with substance abuse patients and mental health. I've worked in Miami, I've worked in San Juan, and I've been here for a few years now in the Maryland area. So I pretty much have worked with a diverse group of clients. One of the important things is the note on cancellations. We do hold you responsible for regularly scheduled appointments and consultations. So whether or not you are able to attend, it is important that you know that if you cannot attend, we still will have a service charge of that it says it also in the documents, the informed consent that you went over. This is an independent practice, so while I share my office with other professionals, pretty much you will be seeing me. I will be your direct doctor. However, it's very important that we go through confidentiality, that everything that we do discuss here stays confidential. It is required by law and pretty much by the state law that we maintain everything confidential. However, if by any chance you tell me at some point, or you say something that has to do with harming yourself or harming other, I am required by law to pretty much report that. So just want you to know that's the only time when I would pretty much breach that confidentiality. When you threat to injure or kill oneself, and you let me know that, or if ordered by a court, that's pretty much when we would reach that confidentiality. Besides that, I want to build a relationship with you where you trust that whatever you're communicating with me, it stays within us. And, I'm here to help you. So that's pretty much one of the important things. Have in mind that you have my number. It is 24/7, just in case that you need to reach me at any point. However, if by any chance you can reach me because I'm out of town, I'm on vacation, or I'm not available at the moment and it is an emergency, I do request that you call your closest hospital or 911. Okay, is that clear?
Yes.
Okay. In reference to the termination of the treatment, we want to get into a plan, because we want to work together and seeing exactly how I can help you. But if by any chance you decide that you do not want to be in my practice anytime, it is important important that you let me know ahead of time to see in what ways, the reasoning for it, or in what ways I can actually help you so that we can stay together and work together through the cognitions. Okay? Well, do you have any questions in reference to this informed consent?
No, everything was pretty clear.
Okay. So right now, what I would need from you pretty much is just to sign here. This is just informed consent, what I went through and what you already read.
Okay.
And just kind of sign there, and I'll sign it so I can put it in your personal file. Okay? Let me sign it here. Okay. Very good. So I'll put this one in here. Okay, Arkira. And how do you prefer to be called? Any specific way?
Oh, you can call me Kira.
Kira. Okay, Kira. So Kira, I see I was going through your intake while you were waiting, and I pretty much got some information from here, but just tell me a little bit about yourself. Tell me more about yourself.
Well, I'm from Southern Virginia. I moved to the Maryland area about 2 years ago. I came here for school, getting my master's in mental health counseling, and just looking to seek help with my anxiety.
Okay, so that was actually what I was seeing it. I just wanted to see exactly what brought you to here today. So anxiety. What causes you anxiety?
Well, when I have something big coming up, such as a test or something at work that's really big, I tend to have a lot of anxiety about it. I get really nervous and very anxious when I think about it. Also, even after that date or a specific thing has passed, I still tend to feel anxious about it because I may be wondering the results, if it's a test, or I may be wondering how someone thought about me, if it's maybe an interview or something. So all around the issue, I just experience anxiety.
Okay, so let me clarify that I understood you correctly. You get anxious when you are presented with some tests, some school tests, when you have a lot going on at the same time, pretty much when you are going to interview, but you also stated that one of the things that gets you anxious is what others think about you. You did mention that. Why do you worry about what others think about you?
It's only sometimes in the respect mostly of work. So if I'm not sure about something that I have to do, or if I've made a mistake about something, I tend to just wonder about the people that I'm working with, their view of me, knowing that I made that mistake or knowing that I messed up somewhere. Just think about how that makes them think of me.
Okay, can you give me an example of a mistake you have made at work?
One time, I was filing some papers, and I put a client's information in the wrong folder. And I did catch the mistake, but I had to inform my supervisor because she looks through the files throughout the day. So I had to inform her that I mistakenly misplaced or put someone's information in the wrong folder. So that's something that would make me think about, because I made that mistake, now what does my supervisor think of me?
Okay, at any moment did you stop to think, and just an example, because I really wanna see what are exactly the things that create that anxiety. However, at that moment, did you pretty much stop and think that someone else could have made that same mistake?
No. I didn't think about that.
Okay, yeah. It's we're humans. We all do make mistakes. I've made mistakes myself. I know every day we pretty much try to strive for perfection, but we're very far away from it. But just to see that, that's one of the example and one of the things that causes the anxiety. That's something that we're going to be working on. To kind of rechannel that. Okay, so I know you're here for, because you want to work on these anxieties. Can you tell me a little bit more about the type of activity at work? Your workload. How is that?
Well, it can get pretty stressful sometimes, particularly at the end and beginning of every month. On a daily basis, I see anywhere from 2 to 5 or 6 clients a day, just depending on how I make my schedule for that day. And we are required to write a summary each time that we meet with the client. So that takes a lot of my time. We also have a lot of assessments that we do for clients, and we have our quarterly treatment plans and monthly summaries that we have to do.
Okay.
And it all is really just that, along with the job itself. It's pretty stressful. So sometimes I get stressed about when I think about how much I have to do for the day or for the week.
Yeah, it does sound a little stressful, and it could be because you have a lot, like you said, thrown at once. You're dealing with schoolwork. You're dealing with clients at work. You're dealing with work itself. It I can totally understand that it could become stressful, and that stress can become make you become anxious. So that's totally understandable. How long have you been experiencing this?
About 3 years now.
All right, about 3 years. And how have you coped up to now?
I just do it. I just go through with it. I don't really think about it. When I have a lot of things to do, I just go through the motions. I don't really think about anything that I could do to reduce my stress or maybe, reduce my workload. I just do it.
Okay, so you pretty much just go through the motions, do your work, and not pretty much give thought to what really is taking place at the moment. You just know that the anxiety level just kicks in, and pretty much that's what you're trying to work on. Okay, totally understandable. So is there a reason why you decided to seek for help now?
Well, I am, as I mentioned, in school for counseling myself, and I do believe in some of the theories and techniques used to help people with certain things. And I'm very aware of them. However, when it comes to actually applying them to my life, especially when I am experiencing high levels of anxiety, it's really hard to apply the things that I'm learning in class to my actual life, just because I'm actually the one experiencing stress or anxiety. It's hard to apply the things that I've learned and tailor them to my actual situations in life.
Okay, but at least you have a base of what exactly to do. It's just how to apply it to your life, as you mentioned. Okay, can you tell me a little bit more about your family background?
Well, I'm very close to my parents. I'm also very close to my brother and sister. I grew up in a very close-knit family. We share a lot. My parents were very structured, so growing up, things were pretty much laid out as far as things that I was responsible for. And my family's very supportive. They support me in pretty much everything that I do, especially school and work. But they're 3.5 hours away, so I don't really see them as often as I would like. but nonetheless, they are supportive.
Nice. You know, it's always good to have that support group. You know, even when mom and dad are not close by, you know, family is not close by. At least is a good thing to know that they're there if you actually do need them. You did mention something that is very important, and obviously knowing that they're there. However, when you speak with them, do they know about these anxieties? Do they know what you experience?
Not on a daily basis. Every now and then, when something comes up that's really serious, or to me, what I feel like is an emergency, I may call them, or if I need some help with something, you know, or some advice on something that I feel like is, you know, really important, I'll call them. But otherwise, I don't really talk to them about my experience with anxiety. When I visit them, I'm in a good space. You know, I'm not really thinking about work or anything because I have to travel to see them. So that's really what I'm thinking about at the time. I'm not really thinking about work or school or anything like that. So when I visit them, it never really comes up, the thought of my anxiety or anything like that.
Okay, so it sounds that while you're spending some time with the family, your mind pretty much is clear of these anxieties and these preoccupations that you have from school, from work, you know, so that really does sound like it is something good that you are doing unconsciously, because maybe you're just thinking, okay, I'm just going to see mom and dad, or, you know, the family. However, you know, if your anxieties do not come at that time, you know, it is a good thing for you, which is always good to know what things we do in our life that pretty much move us away from the negative things that can be happening in our lives, okay? Which is good. You're talking about family, and I did see in the intake that you do have a brother and a sister. How's your relationship with them?
It's very good. My sister and I are fairly close. There's a bit of an age difference between us. She's 13 and I'm 24, so there is a bit of an age difference there, of course. So some things we don't talk about, but for the most part, we have a good relationship. She trusts me. She knows that you know, doing positive things. And my brother, we're not as far apart in age, but we're just very different in terms of our goals and aspirations in life. But we still have a close relationship, and we talk pretty frequently.
Okay, well, that's nice. Well, you do have a very good support system there of family members, which is a good thing. While reading, you know, it was interesting because you did mention your phobias. Can you talk to me a little bit more about that?
Well, I just have a fear of getting a phone call one day and being told that someone very close to me is, you know, passed away. I've never had anybody who's very, very close to me pass away before, but I have had people who I knew very well and, you know, saw around a lot, and like who were friends that passed away. And I've also had people who were very close to me have people who were close to them pass away. So I've just kind of been around them while they were experiencing and going through their grief. And I have a lot of family members who are older, and a lot of situations that's happened in my family where people have lost their lives, and I just have a fear that I'm going to get a call one day and, you know, telling me that someone has passed away.
Okay, and yeah, that could, you know, that really could sink in when you start thinking about that. But you're here for anxieties, and I just want to like put all this together. You're here for anxieties. You did mention that your anxieties, you get them because of schoolwork and work itself. With that being said, is there a reason why you also think about these deaths for any particular reason?
I don't really think the two relate. I don't really think me thinking about death has anything to do with my anxiety. It's just something that I've seen a lot of people go through and deal with. And when I think about it, I'm not really sure how I would deal with that. And I think that probably is what scares me the most, is how I would go on with the loss.
Okay, so pretty much it's more of a fear than anxiety. That doesn't, you're clear that doesn't cause you anxiety.
I don't think
Okay.
they correlate.
Yeah, and just asking because I know I did ask it. It's one of the questions in my intake, and you did answer it. Not everybody dares answer it, so I do thank you for that. For being pretty much thorough in the intake here, which also helps us as therapists kind of have a broader view of the situation that you are presenting. We do ask some questions there, but I ask you some questions because pretty much we really want to engage in some conversation where we pretty much are open to finding a way of working with that anxiety. Okay, so another question that I had for you, because we've talked about your family, we've talked about the anxiety and the things you do. Now, can you tell me a little bit more about what are your strengths?
Well, I am very good at multitasking. Very organized. I also am pretty caring, which kind of is a motivator to continue working, because I do work in this field and I do care about people in less fortunate situations than myself. And I feel that I'm a pretty well-rounded person. I feel that's a big strength of mine.
Okay, which are good strengths to have, and more so when you're aiming to be a therapist. You're going to school to be a therapist, so that is good. But we also have to recognize our weaknesses, and would you be able to tell me which are your weaknesses?
A weakness would be that I overanalyze things sometimes. I think too deeply into things.
Okay.
Another thing is that I think a lot about the negative sometimes instead of the positive. Or I may think about both, but I'll think more about the negative outcome of it rather than the positive outcome. And another weakness would be just being able to understand that some things are just out of my control. I do like to have control of things, especially when I'm the one facilitating it, or if I'm the responsible party for whatever it may be. And even if things go wrong and it's out of my control, I just really have an issue with that.
Okay.
So I think that's another weakness.
It's a weakness, but this is like they say, we can't control actions of others, so we only can control what we do, what we pretty much are entitled to.
Right.
So that would be something that you just gotta try your best to kind of be careful, because you don't want that to affect you as well. So in your day-to-day life. So can you tell me about your social encounters? How's your social life?
Well, I have a decent number of friends. We're very much alike and different. We all have goals and all are working towards them. I like to go out and meet new people and experience new things. I just went horseback riding like a month or two ago, and that was a different experience for me. So yeah, I just like to try new things and meet new people, and I like to party, have a good time. I like good music, and those are all things that I have in common with my peers. So we all just go out and have a good time.
Which sounds nice, because it keeps your mind busy.
Mm-hmm.
Well, you've been with your friends, with your peers and things like that. Have you ever experienced a moment of anxiety?
No. No, not while I'm with my friends. Very, very seldom. Unless there's just something that goes wrong. crisis situation, which doesn't happen often. But other than that, no, I rarely experience anxiety with them.
Okay, well, it sounds like that is something good to have, you know, that group of friends. I know you have your support group, which is your family. You have your friends, which is another support group, because even though sometimes we don't think about it as that, you know, we just think, okay, it's our friends, we're gonna go out, we're gonna have a good time. What we fail to realize is that while we're having this good time with these friends, you know, our mind is being taken away pretty much from all the things that do cause the anxiety, schoolwork, your work within itself. So that is very good to pretty much have this support group. Have you ever talked to them about your anxieties?
Yes, sometimes. My friends know me pretty well as I know them, and you know they know how I am about things. They know what makes me anxious, and what I worry about, or the types of things that I would worry about. But they're always encouraging and very supportive, just like my family.
Which I was gonna ask you. I was gonna ask you if your friends do tell you, give you any guidelines to try to work with that anxiety.
Yeah, whenever I mention, you know, that I'm feeling stressed or feeling like I'm about to have a breakdown or something, you know, I can always go to my friends and, you know, talk to them about it and, you know, count on them to provide encouraging words like you can do it, or, you know, good luck with this, or, you know, just offer just comforting words or advice sometimes if I need it.
Which all sounds like good things, you know, and by what I've read in your intake and the conversation that we have here, you pretty much are clear on what things, you know, you need to have around you in order to work with this anxiety. However, we do want to make a treatment plan here, and we want to work some things out because I really want to help you in this situation of working towards kind of leveling out your levels of anxiety. You know, it's not something that's going to go away tomorrow. You know, it is going to be a process. You know, we are going to set some goals, okay? And before we set those goals, you know, I just want to know what goals you have from this therapeutic session.
Well, I would like to find better ways of coping with my anxiety. I do understand that feeling anxiety is normal. Everyone experiences anxiety about something. So, and I think in a way it may be even healthy sometimes to experience a little bit. That way, I mean, it's kind of like you have something to look forward to or work on. But I just want to learn how to reduce my anxiety and not let it get too, you know, like I said, a little bit I feel like it's natural, but just learning how to not let it affect my everyday process of thinking or, you know, doing work or school. And I also am a believer that, you know, your thoughts influence your behaviors and, you know, the outcome of things. So I really just want to work on keeping my thoughts positive to manifest positive outcomes.
Okay, yeah, and then that is doable, and that's something that we'll all help you with. You know, we'll be working on. Before we get into, you know, what techniques and plan we have, I just had just a few more questions so that we can kind of, you know, I can get a better understanding of certain things of yourself. So I know you did mention in what I read that your mother was very artistic, creative.
Mm-hmm.
You also mentioned that your brother was very artistic. Anything that you have in reference to that?
I'm not really artistic.
Okay.
You mean in reference to me being artistic?
You.
Yeah.
I'm just saying. I know you mentioned some family members do have this. I just wanted to see if by any chance you are artistic or any trait, skill Anything that you do
Um,
of that nature?
well, like I said, I'm not very artistic. I
Okay.
do enjoy art, though. I
Okay.
do enjoy all forms of art, sculptures, paintings, music, theater, dance. I love art, but I'm not that good at it. I do like to dance, and I am like a fan of the theater arts, um, but I kind of leave the artistic stuff with where it's at.
With the other family
Yeah.
member. Okay, that's totally understandable. Just wanted to see, because one of the things we really want to be working on is obviously a plan. We want to make a treatment plan, as I mentioned, and we want to work on coping with these anxieties, but at the same time bringing down the levels. So as you read in my informed consent, and I went over, I do work a lot with. I'm very eclectic, and I do work a lot with the cognitions and any cognitive behavior. So in part of the therapy and the process, we're going to work on doing some homework. Okay, I am going to be giving you some homework, and this is an agreement between you and I. This is something that if I want to help you, you have to be willing to, and up for it for this treatment plan. So it's pretty much like a commitment, because I really do want to help you, and I know you're here seeking for this help. Okay, so as part of the homeworks, we'll go through some different activities, and one of the first thing that I would kind of recommend as working with the anxiety is that you doesn't have to be today. You can just kind of grasp everything that we've talked about today, but starting maybe tomorrow or in the week, that you start analyzing what are the things that make you anxious. So you already mentioned work, school stuff. Okay, you're clear with that, and that's very good when you at least have a clear notion of what is it that's causing these negative thoughts and these negative behaviors in your life. Once you have all that clear, one of the important things to recognize is, okay, if I feel anxious at this time that I'm doing this and this event, let me do less of it to see how I feel. Because maybe there have been moments where you haven't had those events, like when you go home to your parents, you go visit your parents, since you're not doing your schoolwork, since you're not studying for an exam or getting ready for an interview, you pretty much are not experiencing the anxiety. You're pretty much with your positive thoughts. Am I correct in that?
Mm-hmm.
Okay. So as part of the homework, it'll be good for you to say, okay, I am used to taking a lot of work, some of my work, home. However, if I took an amount of 4 hours of work home, how about I try to do as much possible as work, so when I come home, I don't have to do as much work from work at home. Because we really do need we do need some time for ourselves. Even though sometimes we think we don't have the time, one aspect of trying to work with ourselves as human being is having that time for ourselves. And you're not allowing your some time for yourself when you just focus on school activity and on work activity.
Mm-hmm.
So it'll be very good that you start kind of making some time for yourself. As part of the time for yourself, you can kind of like close out your books for a little bit, because what you didn't study in 20 minutes is not going to hurt you, because you'll resume back to it. So you need to kind of regroup, take 15-20 minutes of a day, and kind of center in yourself. When I say center in yourself, you pretty much want to meditate, if that's what you do. Have you ever done yoga before?
Yes.
Okay, and how did you feel about that?
It was good. It was pretty good. It was very relaxing, and I think it helped me.
Okay, well, relaxation is something very good. Okay, so relaxation is something very good that you want to kind of do at home. You know, you can put whatever music, you know, soothing music if you really feel like doing that. The thing here is, and it's important, is that you pretty much take your mind away from everything and that you kind of regroup with yourself in reference to having that time for yourself, relaxation, some music, something that would help you kind of take your mind away from all the activities that cause the anxiety. You also want to, the homeworks, you really want to kind of close up everything that causes the anxiety. If it's anything that has to do with school, you're going to continue to study, you're going to do good, but at the same time, you need to kind of have some time for yourself so that your mind, your mindset, and your brain can kind of regroup. Your mind can kind of have that time of relaxation so that when you pretty much start again studying, you don't feel as antsy as as you have been.
Mm-hmm.
This is all very important, you know, and it's things that I believe are doable, you know, and this is just a way of getting you started, you know, to kind of work on this, because I really do want to see you in 2 weeks, you know, and in 2 weeks, what I would like for you to come back and is tell me how did it work out with these homeworks and these sessions that you did, you know, the relaxation. So pretty much as part of the cognitive recognition will be, you'll do relaxation, you do some cognitive recognition of trying to move away from anything that makes you anxious to more positive things. You know, you can go for a walk because you do that. You know, I've read it on your intake. You have done yoga. You know, do some meditation, things that pretty much will relax you. And once you pretty much feel relaxed, you will be able to regroup and come back to whatever you would, you know, take on whatever you were doing in a more easier way, you know, without feeling so anxious. Do you think that that's something that's doable?
Yes, I do think so. It's
Okay.
definitely doable.
Well, it sounds good. You know, do you have any more questions for me? Anything else that I haven't covered today?
Well, I guess my only question would be, what do you recommend me doing when I'm trying to balance, say, my anxiety and, you know, my social life? Because as I mentioned, I don't really, you know, feel anxious when I'm around my friends or something like that, but in an instance where I would be feeling anxious around them, how do you think I should handle that if we're like out in public or something somewhere?
Okay, which is a good question. So let's say that you're with your friends. You know that while you're with your friends, you're not, you're with your friends, you're having a good time. Okay, so at some point in time, one of those negative thoughts come through that make you start feeling anxious or something, that you're thinking about school, kind of get out of the group, the closest person you have in the group, friend, and just start talking to them. You might want to talk about the movie you saw yesterday. You might want to talk about the latest song that came out or the latest activity that's been going on TV. You know, maybe a program that you're seeing. I know a lot of people talk about Scandal. You know, I don't see Scandal, but you know, if there's a specific program that you like, and if there's a new song that's coming out, you know, you might want to talk about, you know, get in that group, somebody that shares interests like you, and start talking about it. Because the moment you start engaging in a conversation of something that you like, that you truly enjoy, that's when your mind is going to refocus. It's going to take its focus away, what's going to create the anxiety. That might be all the events that you have on life, you know, the pressing events, work, school, tests, and things like that. And pretty much that moment, you're going to focus in on something that is more enjoyable for you. You know, so that's pretty much like what I would recommend. You know, like if you're outside with some friends, if you see that doesn't work, well, how about you just move away from the group? You might maybe walk outside, breathe some fresh air. You know, maybe if you're in a club, a pub, or wherever you meet up with your friends, you know, you can go outside, get some fresh air, kind of take some deep breaths, you know, kind of center yourself and kind of do some positive affirmations, you know, positive affirmations that would help you in kind of recognize, okay, I know I'm getting anxious. I know that pretty much I have to move on, and I know that pretty much I have to do better for myself because I want to feel better. Does that make sense?
Yes.
Okay.
It does.
Well, this would pretty much, if you don't have any other questions, this pretty much will conclude this week's session. Like I said, I want to see you in 2 weeks. You just, before you go out, make your appointment, and I'll see you then. And pretty much we'll be working, work with that homework, and we'll see, when I see you in 2 weeks, where we at with it. Sounds
Okay.
good?
Sounds
Okay.
good.
Well, I'll walk you out here.
Thank you.
Okay.
See you in 2 weeks.